Alright, hi you guys, my name's Grace and I'm going to be telling y'all about urinary tract infections. So, urinary tract infections affect about 150 million people every year, both men and women, so it's super common. UTIs account for about 0.9% of all doctor visits every year and for about 2 to 3 million ER visits every year. UTIs are the second most common infection found in women. So 20 to 30% of women who had a UTI within a year are really commonly going to have 2 to 3 more UTIs within 6 months of that first UTI. So the kidneys make our urine, and they do that by filtering our blood and taking out any waste, and it's going to be made into urine that's going to be traveling down the ureters, stored in the bladder, and then once we get the urge to urinate, we'll excrete it into the environment through the urethra. The entire urinary tract and the urine itself is supposed to be completely sterile, no microorganisms at all. Our body maintains this sterility by some defense mechanisms that we have to keep the urinary tract sterile. So the first one is normal urination pattern. So if we urinate regularly, every 2 to 3 hours or so, we're going to be flushing our system free of microorganisms. So that's how that one would keep us sterile. Our immune system, we know that helps us fight off microorganisms and helps us to stay healthy. So that would also be used with our urinary tract. Ureteral peristalsis is whenever the ureter propels urine down into the bladder. So this is kind of like the normal urination pattern. If the ureter can propel urine and not let it stay stagnant, then we'll have a decreased chance of having microorganisms build up and infect us. We also have a competent ureter vesicular junction. And our urine itself has properties that are antibacterial. So urine is very acidic, it's concentrated, and it has glycoproteins in it. And all of these things should not allow a bacteria to grow because these things make for not a very good environment for bacteria and other microorganisms to grow. But if these defense mechanisms do fail, then bacteria can enter into the urinary tract and infect us. The most common pathogen that we find infecting people with UTIs would be E. coli. And this one's common because it is part of our normal flora in our GI tract. So it is commonly found in the peritoneal area. So it has very easy access to the urinary tract. So bacteria, most commonly E. coli, will ascend up into the urethra, into the bladder, where it'll implant itself into the endothelial wall of the bladder, and it'll colonize and it'll start infecting us. This can also travel up into the ureters, into the kidneys. It could even become septic if it's not treated soon enough. So it's really important that we, as patients, know the signs and symptoms of infection so that we can report those and get those treated early. UTIs are classified as either complicated or uncomplicated, and really the only reason that we do this is to know how to treat them and what medications we should use. So if a UTI is uncomplicated, this means that the bacteria is only infecting the bladder and it's really not that much going on. So they'll be treated with about a 3-day antibiotic therapy regimen. Bactrim, nitrofurantoin, and cephalexin are the 3 most common ones that we see used with uncomplicated UTIs. And then if somebody has a complicated UTI, this is typically because there is some kind of structural or functional problem in the urinary tract that is causing the infection to have began in the first place. So things like obstructions, stones, strictures, maybe they have retention, different things like that would be indicative of a complicated UTI. These people would be treated like a little longer. 1 to 2 week antibiotic therapy. Fluoroquinolones are really commonly given. Levofloxacin and Cipro are the 2 most common ones. So some of the risk factors for UTIs, the most common one is invasive procedures to the urinary tract, and we know that anytime something invasive is done to the body, we're going to have an increased risk of getting an infection. So the most common invasive procedure of the urinary tract would be a catheter. So CAUTIs, catheter-associated urinary tract infections, are the most common HAIs, hospital-acquired infections. This is because the catheter, the rubber tubing, provides a great access point, easy access point to the urinary tract. And this is why we really try hard to not have to put a catheter in. And if we do, we try to take it out ASAP, and we really try to keep the catheter area really clean while they're staying in the hospital. A cystoscopy is another kind of urinary invasive procedure that could increase the risk of a UTI. Females are also more common to have UTIs than males because the female urethra is a lot shorter than the male urethra, giving it an easier and quicker access point for that bacteria to enter. Also, urinary and renal impairment, obesity, elderly, debilitated and immobile people, people who have reoccurring UTIs, people who are immunosuppressed, people who have urinary retention, people with diabetes, urinary calculi, which are kidney stones, people who have frequent constipation or delayed urination, or maybe they're just not emptying all the way whenever they go to the restroom. That can cause urine to be stagnant and increase risk for infection. Someone who has poor perineal hygiene would increase their chance of getting an infection from that normal flora. If you're not voiding after intercourse, or if you're using external irritants that irritate the perineal area, that could cause a UTI. So, the most common signs and symptoms of UTIs would be LUTs, the lower urinary tract symptoms. This is dysuria, that painful burning urination, frequency, urgency, cloudy urine. The urine is supposed to be clear, no sediment. So when we do see this sediment or this cloudy look to the urine, that would be indicative of a UTI. Suprapubic discomfort and hematuria, or blood in the urine, would be the lower UTI symptoms. If this infection continues up and it gets worse, maybe you'll see some systemic symptoms like fever and chills, flank pain, bacteria, and fatigue. So it's really important that we understand that older adults don't have those common signs and symptoms of the UTI. They are more likely to present with abdominal pain, mental status alterations, and confusion, where you might not really think it would be a UTI, but they end up having an infection. So treatment usually is responded to very well and rather quickly. So diagnosis is always going to be a clean catch urinalysis, where you clean the perineal area with something aseptic, urinate into the toilet for a few seconds, and then catch the rest into the sterile cup. We're gonna see everything in the urine: white blood cells, red blood cells, pathogens. We're gonna see everything in the urine, what the urine's made out of, and that'll tell us if there is an infection. And then we can do a CNS, a culture and sensitivity, to see what is exactly infecting the patient and what antibiotics will eradicate it. So that's where we get at that antibiotic therapy is the number one treatment to eradicate the pathogen, and that of course will depend on if it's classified as complicated or uncomplicated. Also, if someone has those reoccurring UTIs that they won't stop getting them, they can be given a suppressive antibiotic to help them not get those UTIs. Also commonly given with a UTI is urinary analgesics. The most common one is phenylazopuridine, that will help with pain. It's a dye that coats the inner mucosa of the urinary tract, and it will be excreted as a bright orange urine that will stain everything that it comes in contact with. So that would be important to tell the patient that that is normal with this urinary analgesic. When we're educating the patient, we're going to want to make sure that we teach them those signs and symptoms of infection, specifically UTI, so that they can seek treatment early in the future and prevent complications. We need to teach the patient that they need to finish the entire antibiotic course, even if they are feeling better, because we want to prevent antibiotic resistance and superinfections in that patient in the future. We want to increase fluids with a UTI so that we can flush the urinary tract and flush that bacteria out. We want to avoid those ingestible and outer irritants. We want to make sure that we're urinating after intercourse. And especially in females, we want to make sure that they're wiping front to back, having that good perineal hygiene so that we don't get that E. coli into the UTI in the urinary tract. We want to wear loose-fitting bottoms and cotton underwear. And we want to make sure that we're urinating often and emptying the bladder completely so that that urine is not stagnant. And that is it. Thank you.